March 1943. Reserve Hospital Hohenlichen, 80 kilometers north of Berlin. Soviet prisoner Pyotr Volkov was wheeled into an operating theater that looked like any modern surgical suite in wartime Germany. Clean white tiles, sterilized instruments, nurses in pressed uniforms. The surgeon who bent over him, Professor Karl Gebhardt, was the personal physician to Heinrich Himmler and president of the German Red Cross. The facility was immaculate, professional, indistinguishable from legitimate medical institutions, except for one detail. Volkov wasn't there for treatment. He was there to be deliberately infected with gas gangrene to test whether sulfanilamide drugs could prevent the infection from spreading. He would survive the next 6 weeks. Others wouldn't. The paradox of Hohenlichen was that it functioned simultaneously as both a legitimate orthopedic hospital and a site of systematic medical torture. Wehrmacht officers recovering from combat wounds occupied the East Wing. Prominent Nazi officials came for treatment and rehabilitation. The facility had a reputation for excellence in sports medicine and orthopedic surgery. Professor Gebhardt had treated German Olympic athletes. The hospital's grounds were landscaped, well-maintained, orderly, and in the basement surgical suites and isolated wards, prisoners from Ravensbrück concentration camp 15 kilometers away were subjected to deliberate infections, unnecessary surgeries, and experimental procedures that violated every principle of medical ethics. The experiments began in July 1942, following a medical controversy within the Nazi regime. Reinhard Heydrich, Deputy Reich Protector of Bohemia and Moravia, had been assassinated by Czech resistance fighters in Prague on May 27th. He died 8 days later from wound infections, specifically septicemia resulting from bacteria introduced by grenade fragments. The official investigation suggested that Heydrich might have survived if he'd received proper treatment with sulfanilamide drugs, the newest antibiotics available. But Gebhardt, who'd been called to Prague to treat Heydrich, had not administered sulfa drugs aggressively, choosing instead to rely on traditional wound cleaning and surgical debridement. Himmler wanted to know whether Gebhardt's treatment decisions had killed Heydrich. More broadly, the SS wanted definitive proof that sulfa drugs were or weren't effective against battlefield infections. Rather than conduct ethical clinical trials, Gebhardt proposed using concentration camp prisoners as experimental subjects. He would deliberately inflict wounds similar to those Heydrich suffered, infect them with bacteria, and test whether sulfa drugs could prevent death. The experiments would provide data impossible to obtain ethically, while simultaneously defending Gebhardt's medical reputation. The protocol was systematic and calculated. Prisoners, initially Polish women from Ravensbrück, were selected, anesthetized, and subjected to surgical procedures that created wounds similar to combat injuries. The surgeons would make deep incisions in the leg, then introduce bacteria and foreign material, dirt, wood splinters, glass fragments, to simulate battlefield contamination. Some wounds received sulfa drugs. Others served as controls, receiving no treatment. The medical staff monitored infection progression, documenting symptoms, measuring bacterial spread, and recording whether subjects survived. The first series of experiments, conducted between July and September 1942, produced results that satisfied no one. The wounds, while deliberately infected, didn't accurately reproduce battlefield conditions. The infections were less severe than expected. The mortality rate was lower than combat wound statistics. Gebhardt concluded that the experimental methodology was insufficiently realistic. The next series would be more aggressive. Beginning in September 1942, the procedures became more deliberately destructive. Surgeons not only created wounds, but actively damaged tissue to simulate the crush injuries and shrapnel damage of combat. They ligated blood vessels to create tissue death from oxygen deprivation. They introduced larger quantities of more virulent bacteria. The experimental subjects now faced infections that genuinely threatened life, making the test of sulfa drug effectiveness more definitive, but also more lethal to those in control groups who received no treatment. The medical staff at Hohenleichen maintained meticulous records. Patient charts documented preoperative condition, surgical procedures performed, bacteria strains introduced, temperature readings, white blood cell counts, tissue necrosis progression, and ultimate outcome. The documentation was indistinguishable from legitimate clinical research, except for the absence of consent and the deliberate infliction of potentially fatal conditions. The researchers published some findings in German medical journals, carefully omitting methodology details that would reveal the criminal nature of the experiments. 74 women underwent the wound infection experiments between July 1942 and August 1943. 5 died during the procedures or from immediate complications. 16 died from infections that the medical staff allowed to progress without intervention. 53 survived but suffered permanent disabilities, including chronic pain, mobility impairment, and disfigurement from the experimental wounds. The medical staff referred to them as Kaninchen, rabbits, reducing human subjects to laboratory animals in both terminology and treatment. The sulfanilamide experiments were only one research program conducted at Hohenleichen. Gebhardt also tested bone grafting techniques using prisoners as donors and recipients without consent. He conducted experimental nerve regeneration surgeries, deliberately severing nerves to study whether they could be surgically reconnected. He tested new surgical instruments and techniques on prisoners who'd been given no choice in participation and often no anesthesia beyond what was minimally necessary for the surgeon's convenience. The facility's dual nature created a bizarre operational reality. Wehrmacht officers recovering from legitimate injuries occupied comfortable rooms with views of the hospital grounds. They received professional medical care, nutritious meals, and respectful treatment. 3 floors below, prisoners lay in locked wards, their deliberately infected wounds monitored by the same medical staff who'd inflicted them. The juxtaposition was striking and deliberate. The hospital maintained its reputation for excellence, precisely by segregating its criminal activities from its legitimate medical functions. Soviet prisoners arrived at Hohenleichen beginning in 1943, transferred from various POW camps where they'd been identified for medical purposes. The Red Army's collapse in 1941 and 1942 had left millions of Soviet soldiers in German captivity. The Wehrmacht and SS regarded Soviet POWs as expendable resources, useful for forced labor or, in the case of medical experimentation, as test subjects whose suffering had no moral weight in Nazi ideology. The Soviet prisoners underwent procedures similar to those inflicted on Polish women, but with a focus on different medical questions. Gebhardt became interested in treatments for frostbite and cold injuries, increasingly relevant as the German military struggled through winter warfare on the Eastern Front. Soviet prisoners were subjected to controlled frostbite, their limbs exposed to freezing conditions to study tissue damage progression and test various warming and treatment protocols. The experiments were justified internally as militarily necessary research that would save German lives. If frostbite treatments could be developed, Wehrmacht soldiers would benefit. If wound infection protocols could be optimized, combat casualties would decrease. The logic was coldly utilitarian. Sacrifice expendable prisoners to preserve valuable German military personnel. The medical staff convinced themselves, or at least claimed, that they were serving a greater good. If you're finding this examination of how institutional legitimacy can mask systematic atrocity compelling, Subscribing helps ensure you don't miss future investigations into history's uncomfortable truths. The reality was less about military necessity and more about careerism and ideology. Gebhardt used the experiments to enhance his professional reputation, presenting findings at medical conferences and publishing in journals. His proximity to Himmler gave him political protection. The research, however criminal, advanced his academic standing within the Nazi medical establishment. Other physicians at Hohenleichen participated partly from ideological conviction that prisoners were legitimate experimental subjects and partly from professional ambition. The hospital's location contributed to its operational security. Hohenleichen was isolated, accessible only by controlled roads. The facility's reputation as a rehabilitation center for wounded soldiers provided cover for the prisoner transfers and experimental activities. Local residents knew the hospital existed, but had no visibility into its basement surgical suites or isolated wards. The clean, professional appearance masked the criminal activities occurring behind closed doors. By 1944, as Germany's military position deteriorated, the experiments at Hohenleichen decreased in frequency, but not in severity. The arrival of wounded soldiers from both Eastern and Western fronts meant the hospital's legitimate medical functions expanded, consuming resources and staff time. But the experimental programs continued sporadically through early 1945. Gebhardt maintained his research activities even as the Reich collapsed, convinced perhaps that the data he was generating would prove valuable, regardless of Germany's military fate. The liberation of concentration camps in April and May 1945 exposed the full scope of Nazi medical crimes. Allied investigators found survivors at Ravensbrück who'd been subjected to experiments at Hohenleichen. The women's testimony, combined with recovered medical records, documented the systematic nature of the program. The meticulous German documentation that had been intended as scientific rigor became evidence of systematic criminality. Professor Gebhardt was arrested by American forces in May 1945. Unlike some Nazi physicians who destroyed evidence or fled, Gebhardt maintained that his research had been legitimate medical necessity. He argued that wartime conditions justified experimental methods that would be unethical in peacetime. He compared his work to Allied medical research, suggesting that all nations had conducted similar experiments under different names and with better public relations. The Nuremberg Doctors trial, which began in December 1946, charged Gebhardt and 22 other Nazi physicians with war crimes and crimes against humanity. The prosecution presented detailed evidence of the Hohenleichen experiments, including testimony from survivors and the hospital's own medical records. The documentation was so thorough that defense arguments about military necessity or scientific validity crumbled under the weight of recorded evidence showing deliberate torture disguised as medical research. Gebhardt's defense strategy was revealing. He didn't deny conducting the experiments. Instead, he argued that prisoners in concentration camps were already condemned, and that using them for research that might save German soldiers was ethically defensible within the context of total war. He claimed that all research involved some risk to subjects, and that wartime simply shifted the calculus of acceptable risk. The tribunal rejected this reasoning comprehensively, establishing that medical ethics had absolute boundaries that couldn't be suspended by military necessity or ideology. The verdict came in August 1947. Gebhardt was found guilty on multiple counts and sentenced to death. He was hanged at Landsberg prison on June 1948, along with 6 other convicted doctors. The trial established precedents that shaped post-war medical ethics, including the principle that human experimentation required informed consent regardless of circumstances, and that physicians had an obligation to do no harm, even when ordered otherwise by legitimate authority. But the legacy of Hohenleichen extended beyond individual punishment. The hospital itself was dismantled after the war. Its buildings eventually converted to other uses. The medical records were preserved as evidence and later as historical documentation. The survivors, particularly the Polish women who'd been subjected to the earliest experiments, spent decades seeking recognition and compensation. The West German government eventually provided limited restitution in the 1960s, though no monetary payment could adequately compensate for permanent disabilities and decades of suffering. The broader question of how medical professionals could participate in systematic torture troubled post-war observers. Gebhardt wasn't an isolated sadist, but a respected physician who'd trained in legitimate medical institutions, practiced conventional medicine, and treated patients professionally when they were German nationals. The hospital at Hohenleichen wasn't a primitive torture facility, but a modern medical institution with advanced equipment and trained staff. The experiments weren't chaotic brutality, but carefully documented research programs. This normalcy was precisely what made Hohenleichen so disturbing. It demonstrated that systematic atrocity didn't require obviously evil settings or overtly monstrous individuals. It required only the combination of ideology that dehumanized certain groups, authority that provided protection from consequences, and professional ambition that prioritized career advancement over ethical constraints. The clean white tiles and sterilized instruments didn't prevent atrocity. They provided the veneer of legitimacy that allowed it to continue. Modern medical ethics emerged directly from the confrontation with Nazi medical crimes. The Nuremberg Code, established during the doctor's trial, provided the foundation for all subsequent human research protections. The Declaration of Helsinki, adopted by the World Medical Association in 1964, built on these principles. Contemporary institutional review boards, informed consent requirements, and protections for research subjects all trace their origins to the recognition that medical legitimacy and criminal conduct could coexist if not actively prevented through binding ethical standards. The survivors of Hohenleichen carried physical and psychological scars for the remainder of their lives. Many experienced chronic pain from the experimental wounds. Others suffered recurring infections in damaged tissue. The psychological trauma of being reduced to experimental material, of watching fellow prisoners die from deliberately inflicted conditions, of knowing that physicians had violated their oaths so completely, proved in many cases as debilitating as the physical injuries. March 1943. Hohenleichen. Pyotr Volkov lay on a surgical table in a spotless operating theater, about to be deliberately infected with life-threatening bacteria by a physician who'd sworn an oath to do no harm. The hospital around him functioned normally. The grounds were maintained. The equipment was modern. The staff was professional. But beneath the surface of medical legitimacy, systematic atrocity was normalized, documented, and defended as military necessity. Volkov survived his infection. The institution that inflicted it survived only until liberation exposed the reality behind the clean white tiles and sterilized instruments. But the question Hohenleichen posed remains. How do we ensure that professional legitimacy never again provides cover for systematic criminal conduct?